Ever been talking to a girl alone and suddenly felt that wet spot? You're not alone. Here's why it happens in seconds. Hey everyone, Dr. Eva Danielle here, men's health expert. Welcome back to the channel. Today we're tackling something that a lot of guys experience, but almost nobody talks about. Experiencing physical arousal or even pre-ejaculatory fluid during normal, non-sexual conversations with women. Before we dive in, hit that subscribe button. We're going to break down the actual physiology of what's happening, why it happens, whether it's normal, and how to manage it. Only about 15% of you are subscribed, so let's change that. Now, let me be clear from the start. If you're experiencing this, you're not alone, you're not weird, and there's usually nothing medically wrong with you. This is actually a very common physiological response that has to do with how male arousal works, nervous system activation, and hormonal responses. But understanding what's happening can help you feel less anxious about it, which ironically often reduces how frequently it happens. So today we're breaking down the science, discussing when it's normal versus when it might indicate something to address, and giving you practical strategies for managing it. Let's get into it. Understanding male arousal. It's not always about sex. First, we need to understand something fundamental about male sexual physiology. Arousal and erection can happen for reasons that have nothing to do with sexual thoughts or attraction. Your nervous system controls arousal through two main pathways. Psychogenic arousal. This is arousal that comes from mental/emotional stimuli, sexual thoughts, visual attraction, fantasies, etc. Reflexogenic arousal. This is arousal that happens from physical stimulation or certain physiological states, completely independent of sexual thoughts. But there's also a third category that's less talked about. Nervous system arousal. This is when your autonomic nervous system activates in response to excitement, nervousness, or heightened emotional states, which can trigger physical arousal responses even without sexual content. Here's what most men don't realize. The nervous system pathways for excited/nervous and sexually aroused overlap significantly. Your body sometimes can't clearly distinguish between "I'm nervous talking to this attractive person" and "I'm sexually aroused." What's actually happening physiologically? When you're in a conversation that makes you nervous, excited, or emotionally activated, which often happens when talking to someone you find attractive or impressive, several things happen. Adrenaline and noradrenaline release. Your sympathetic nervous system activates, releasing stress hormones. This is the same system that activates during arousal. Increased blood flow. Your heart rate increases, blood pressure rises, and blood flow increases throughout your body, including to your genitals. Parasympathetic activation. Paradoxically, social interaction, especially positive interaction, can also activate your parasympathetic nervous system, the rest and digest system, which is the same system involved in sexual arousal. Dopamine release. Novel, exciting interactions trigger dopamine, the neurotransmitter associated with reward and pleasure. Dopamine is also heavily involved in sexual arousal and desire. So you've got this complex cocktail of neurochemical and physiological activation happening that can trigger physical arousal responses, even though you're just having a normal conversation. Pre-ejaculatory fluid. What it is and why it happens. Now, let's talk specifically about pre-ejaculatory fluid, pre-cum, because this is what some men experience during these situations. Pre-ejaculatory fluid is produced by the Cooper's glands, also called bulbourethral glands. These are two pea-sized glands located near the base of the penis. Their function is to neutralize residual acidity in the urethra, provide lubrication, prepare the urethra for ejaculation. This fluid is released during arousal. But here's the key. It doesn't require full sexual arousal or erection to be released. Some men produce it with even mild physiological arousal. The amount varies tremendously between men. Some men produce almost none even during intense sexual activity. Others produce significant amounts with minimal arousal. Both are completely normal variations. Why this happens during conversations. So why does this happen during normal conversations with women? Several factors: attraction and nervous system activation. If you find the woman attractive, your brain is processing that attraction even if you're not consciously having sexual thoughts. This can trigger mild arousal responses. Performance anxiety. If you're nervous about making a good impression, that anxiety activates your nervous system in ways that can trigger physical responses. Heightened emotional state. Excitement, nervousness, happiness, anxiety. All of these emotional states involve neurochemical changes that can trigger physical arousal. Hormonal factors. If you have high baseline testosterone, you may be more prone to physical arousal from non-sexual stimuli. Young men, teens to mid-20s, often experience this more frequently due to higher testosterone levels. Lack of recent sexual activity. If you haven't ejaculated recently, your body is more sensitive to any arousal triggers. Built-up sexual tension means your threshold for physical response is lower. Psychological association. If you're not frequently around women you find attractive, those interactions become more novel and exciting, which triggers stronger physiological responses. When this is normal versus when to be concerned. Let's establish what's normal and what might warrant attention. Normal. Occasional mild arousal during conversations with attractive people, more frequent in younger men. Teens through 20s. Reduces with age and experience, doesn't interfere with your ability to function normally, goes away relatively quickly after the interaction, happens more when you're attracted to the person or nervous. Potentially concerning. Happens during every single interaction with women. Regardless of attraction, causes significant distress or interferes with your life, accompanied by intrusive sexual thoughts you can't control, results in visible erections you can't manage, accompanied by compulsive sexual behavior associated with anxiety disorders or OCD patterns. If you're in the second category, particularly if it's causing significant distress, it might be worth talking to a healthcare provider or therapist who specializes in sexual health. The anxiety feedback loop. Here's something critical to understand. Anxiety about experiencing arousal often makes it worse. When you're worried about getting aroused during a conversation, you're hyper-aware of any physical sensations monitoring your body, constantly creating additional anxiety, which activates your nervous system, making the thing you're worried about more likely to happen. Practical management strategies. So what do you actually do about this? Here are evidence-based strategies. 1. Increase exposure. The more frequently you interact with women in normal, non-sexual contexts, the less novel and activating those interactions become. Your nervous system habituates. If you're isolated or rarely interact with women, each interaction carries more emotional weight and triggers stronger responses. Practical application. Increase social interactions. Generally practice having normal conversations with women in low-stakes contexts, coworkers, classmates, friends of friends. The more normal these interactions become, the less your nervous system treats them as special events. 2. Cognitive reframing. How you think about the situation affects your physiological response. Instead of, "Oh no, this is happening again, this is terrible, what if she notices?" Try, "My body is having a normal physiological response to an exciting interaction. This is not dangerous or abnormal. It will pass." The second response doesn't add anxiety on top of the physical sensation, which helps prevent escalation. 3. Grounding techniques. When you notice arousal starting, use grounding techniques to shift your nervous system state. The 5-4-3-2-1 technique. Name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. This redirects your attention and activates your conscious mind, which often reduces automatic arousal responses. Deep breathing. Slow, deep breathing activates your parasympathetic nervous system in a way that reduces anxiety-driven arousal. Breathe in for 4 counts, hold for 4, out for 6. Repeat 3 to 5 times. 4. Physical redirection. Subtle physical movements can help. Shift your weight or position, engage your leg muscles, tensing and relaxing. Focus on your posture and standing/sitting upright if possible. Briefly excuse yourself to the restroom to reset. 5. Mental redirection. Actively redirect your thoughts to non-arousing content. Math problems, genuinely effective. Try calculating 17 by 23 in your head. Lists, name all 50 states, countries you visited, your favorite movies. Focus intently on what she's actually saying and formulate thoughtful responses. The key is engaging your conscious, analytical mind, which competes with automatic arousal responses. 6. Regular sexual release. If you're going long periods without ejaculation, your body becomes more sensitive to any arousal triggers. Regular masturbation, not excessive but regular, can reduce this hair trigger sensitivity. For most men, ejaculating every 2 to 3 days keeps baseline arousal from building up to levels where minor stimuli trigger strong responses. 7. Exercise and physical activity. Regular exercise helps regulate your nervous system and reduces baseline anxiety. It also provides a healthy outlet for energy and tension. Men who exercise regularly typically report better control over their arousal responses compared to sedentary men. 8. Address underlying anxiety. If general anxiety is an issue for you, addressing that will help with this specific issue. Consider therapy, particularly CBT for anxiety, meditation and mindfulness practices, regular exercise, adequate sleep, reducing caffeine and stimulants. The clothing strategy. Practically speaking, wearing the right clothing can help you feel less anxious. Underwear that provides support, boxer briefs rather than loose boxers. Slightly looser pants, not baggy but not skin tight. Longer shirts that can be adjusted if needed, dark colors that show less if you're concerned about visible wetness. This isn't addressing the root cause, but it can reduce anxiety, which helps break the feedback loop. The developmental perspective. It's important to understand that this issue is most common in younger men and typically improves with age and experience. Teens and early 20s, very common due to highest testosterone levels, less experience managing arousal, more novel interactions with potential partners, less developed anxiety management skills. Late 20s to 30s usually decreases as more social experience with women, better emotional regulation, slight decline in testosterone from peak levels, more normalized interactions. 40s and beyond, rarely an issue due to extensive social experience, well-developed emotional regulation, further testosterone decline, normalized view of opposite-sex interactions. So if you're younger and experiencing this, know that it typically gets better with time and experience. When to seek professional help. Consider talking to a healthcare provider or therapist if medical evaluation needed. You're experiencing spontaneous ejaculation, not just pre-cum. During normal activities, you have physical discomfort or pain you're concerned about hormonal imbalances. This started suddenly after being fine previously. Psychological support needed. This is causing severe distress or impacting your quality of life. You're avoiding normal social interactions. Because of this, you have intrusive sexual thoughts you can't control. You suspect OCD or anxiety disorder patterns. You're experiencing shame that's affecting your mental health. There's no shame in seeking help. These are normal concerns that professionals address regularly. Reframing the experience. Let me offer a different way to think about this. Your body's arousal response, while sometimes inconvenient, is actually a sign that your sexual physiology is working normally. You're experiencing attraction, excitement, and nervous system activation. All normal, healthy human responses. The issue isn't that your body is broken. It's that you're experiencing a normal response in a context where it feels inappropriate. Many men who worry about this are actually experiencing evidence that they're capable of arousal and attraction, which is healthy, responsive to social and emotional stimuli, also healthy, having normal nervous system function. The problem is often more about anxiety and context than actual dysfunction. The social skills component. Here's something else to consider. Improving your overall social skills and comfort in conversations can reduce the nervous activation that triggers arousal. When you're confident, comfortable, and present in conversations, you experience less anxiety-driven nervous system activation. Work on active listening skills, being genuinely curious about others, maintaining natural eye contact, having topics you're knowledgeable and passionate about, seeing women as complete people rather than just potential partners. The more comfortable you are socially, the less your nervous system treats these interactions as high-stakes events. Final thoughts. Experiencing physical arousal during normal conversations is more common than you think. It's usually a combination of attraction, nervous system activation, hormonal factors, and anxiety, not a sign that something is wrong with you. The key strategies are: increase exposure to normalized interactions, manage anxiety rather than trying to eliminate arousal, use grounding and redirection techniques, address underlying anxiety. If present, maintain regular sexual release, exercise regularly for nervous system regulation, give yourself permission to be imperfect. Remember, this typically improves with age and experience. You're not broken. You're experiencing normal human physiology in contexts that sometimes feel awkward. If this video helped you feel less alone or anxious about this, hit that like button and share it. There are a lot of guys who need to hear this but won't ask. Subscribe to the channel for more honest discussions about men's health topics that nobody else wants to address. Drop a comment if you have questions or want to share your experience. Anonymously is fine. I read every comment. My name is Dr. Eva Danielle, men's health expert. Thank you for watching, and I'll see you in the next video. Remember, your body working normally is not a problem. It's just being human.